Hi, myself Dr. Vishwanath, a consultant physician and diabetologist. Today, in a video series of Decoding Diabetes, in this third video, I will discuss a very important test called Hba1c, also called as glycosylated hemoglobin. This test is very important in diagnosing diabetes along with fasting blood sugar and postprandial blood sugar, and also in a follow-up of patients who are already diabetics or pre-diabetics, whether to know whether diabetes is under control or not. The results of this blood test are usually mentioned in percentages. Suppose those who are diabetic, if it is Hba1c is between 6.5% to 7%, that means sugars under very much control. It is between 7 to 8%, it is okay. And if it is above 8%, definitely sugars are not in control and medication has to be upgraded or optimized. Regarding the diagnosis of a diabetes or a pre-diabetes, if the Hba1c is less than 5.8, it's considered normal. If it is between 5.8 to 6.4 percentage, it's called pre-diabetic. If it is above 6.5, it's called as diabetes. There are some conditions which affect this Hba1c value. For example, people who have a kidney failure, people who have too much of alcohol intake from the chronic alcohol intake, people who have high triglycerides in the blood. For those people, Hba1c may falsely go high. That means they may get a false high reports. And for people who have some blood disorders like sickle cell anemia, thalassemia, or a blood loss, for them Hba1c may get lower than the normal. So apart from this, as I see in my clinical practice, many people miss to do this test along with fasting blood sugar and after food blood sugars. So my suggestion is, you can do a fasting blood sugar and after food blood sugar at your home on a weekly basis by using a glucometer. But once in 3 months, never forget to do this test Hba1c, because this is an average of the blood sugar the last 2 to 3 months, which can reflect whether your sugars are under control in the last previous 2 to 3 months. The fasting sugar and after food sugar only tells about sugars at that particular point of time, but Hba1c tell you what's the average in the last 2 to 3 months. So people, suppose somebody is a pre-diabetic, for them at least they should get a test done once in 6 months to know whether you're still in a pre-diabetic, whether you become normalized or you become diabetic. In this way, Hba1c is a very important test in monitoring of blood sugars and in the diagnosis of the blood sugars. The way ahead, there is a lot of talks about continuous glucose monitoring that will give more special information, more specific information about sugar fluctuations over a day. So this is in brief about Hba1c. For people who are diabetic or who are pre-diabetic, keep monitoring this blood test regularly to assess your blood sugars in the previous 2 to 3 months. Bye for now. Again, I come up with another video after some time.